is enriched with eminent experts from AIMS and INIs, representatives from state.
Not born just like that. There is a tremendous amount of hard work involved in building these campuses, whether it is the vision of Sri Narendra Modi ji or Sri Nadda ji, or identifying the site between three hills with huge forest between, our visionary leader Sri Nara Chandrababu Naidu Garu, and all the government officials involved in this process. I also wanted to thank for completely utilizing the existing campus by sanctioning additional posts, Sri Nirmala Sitharaman ji, and facilitating all of these things for the people of Guntur and Mangalagiri area. So I wanted to thank you for that. And second, I am not supposed to be here, but some reason yesterday they told me Naddaji was not able to. Come, can you? Patient safety is something that I have deep experience in. Thank you for inviting me. This is a passion. And second, this patient safety is an important topic. Why? Why it is such an important topic? Can any of you guess how many deaths are happening because of the medical errors within the hospital systems in India? Can anybody guess what would be the total number annually? So it's 5 million. So 50 lakh people are dying annually in India because of the healthcare related errors. I mean, it's a staggering number. If you take the same numbers in United States, annually it is around 250,000 deaths. Of course, we have 4 to 5 times population, but even if you multiply that, their death rate is 1 million, population adjusted metric, and we are 5 million. So we are 5 times more. And the average adverse event rate in US, if you take it, educate you why this is important. Second, medical safety is something that distills during the time of education. It's in the medical colleges. You look at it, even United States, being such an advanced country, spending billions of dollars for building the safety net, was not included in the educational system until 3 years ago. 3 years ago, they have instilled the entire patient safety into the medical educational curriculum. Now it's being routinely tested. I see a lot of medical students here. If any of you are planning to write USMLE, this topic is extremely important for you. So you pay attention to some of the things that I'm going to tell you. But it's into the curriculum and you test some way. Sometimes people may not take it seriously. And I request to consider that. That's one suggestion I have. You look complex processes, checklist. Everything that you do is what makes the system really work. Therefore, the leadership commitment and believing this is extremely important. And the fifth reason is for our own health. I mean, you look at it, some of the richest people, even today, if they have a serious illness, they try to travel abroad. Why? Fundamentally, there is a trust issue. Why is the trust issue happening? I mean, these are the reasons. Safety is one of the foundation of the trust, as everyone have said. And you look at one of the reasons in patient safety, one of the problems of the not implementing patient safety is, for just to give you an example, of the not implementing patient safety is, for just to give you an example, antimicrobial resistance across the world. However, by 2050, antimicrobial resistance will lead to 10 million annual deaths. That means 1 crore people will die if we run out of antibiotics. Therefore, if we lose antibiotics, we are essentially losing modern medicine. These are all good when you take safety. It starts with whether it is education or anywhere, you really need to understand the definitions of the patient safety. What are the preventable medical errors, non-preventable medical errors? Because it makes a huge difference. Non-preventable error, for example, if somebody takes an antibiotic and you get anaphylaxis and people might die. But there is not a whole lot we can do. Obviously, you can do certain extent if the patient already has a known allergen that you already know that there is an allergy, it's obviously a preventable medical error. All it needs is a proper tag to identify the patient allergy, document it, and a nurse can simply ask, or a pharmacist or a physician can ask. That much important to understand the definition, whether it is a sentinel event or near miss event. These need to be known. And the definition between an active error, a latent error, what is the difference between active errors or the frontline errors? Whereas the latent errors, these are the things that go under the rug, that it would take a lot of time and multiple errors before you can actually identify an error. So understanding these definitions are important. Second, and understanding the causes of error is also important. Again, if you lump broadly like infection and all that stuff, you may not get the complete picture because it has a patient-related errors, provider-based errors, and a system-based errors. Patient-based errors, for example, you could provide the best medicine, for example, insulin for a type 1 diabetic. I was in Guntur General Hospital looking at a child, an 8-year-old, came in with diabetic ketoacidosis. I asked what happened. Obviously the patient was not taking insulin. Why they are not taking insulin? Because they cannot afford, so they are mixing, or they are missing the doses. I mean, these are the patient literacy, understanding that they really, what will happen to them if they don't take. So somebody, whether the nurse or a physician, taking the time to explain these things, the literacy issues, it is a simple fixing. That doesn't require a lot of money. It requires a human motivation and interaction. Cultural factors, language barriers, obviously, you have a lot of taboos. People may not come to the hospital. Again, exploring with the open-ended communication and understanding the patient deeply will help you. And then the provider basis, right? A lot of providers, we think here, especially in a lot of places, once we are done with the medical college or residency, we think we have mastered everything.